The Senate is going to vote on just a straight repeal, though it doesn't look like it's going to pass. But is that what happens to Missouri if they do end up repealing the Affordable Care Act, or it implodes and fails and goes away?
Sure. So the repeal bill, first of all, let me talk about that. The repeal bill, as you said, probably does not have the votes that it needs to pass. But if it were to pass, all of the data indicates that about 32 million people across the nation would lose their health care. And that includes 500,000 Missourians. We know that in addition, to people losing assistance through the marketplace and subsidies that help them purchase insurance, there are caps currently in what's called Obamacare that help us keep the cost of insurance down or keep it from growing. And so the indicators show that if the repeal bill were to pass, our premiums would increase by 25% in the first year.
I thought Missouri rejected the Medicaid money. So why would it be so hurtful if we never took the money?
Well, these are folks who are getting insurance through the other provisions that were part of the ACA, the Affordable Care Act. So there are subsidies to help people purchase insurance that are a piece of that. There are requirements that insurance companies keep administrative costs down. They have to be below 10% of the total cost of premiums. There are requirements that insurance companies can't ban you if you have a pre-existing condition. So if you've had cancer or if you've had, osteoporosis, any of those conditions that could, in the past, allow insurance companies to prohibit certain services for you, they're not allowed to do that anymore. And a lot of people ended up receiving health care because of that.
But as things stand now, if it fails, right, if the administration either says it's failing or will do things to push it over the edge, what happens then here in the state of Missouri?
So there are things that, as you said, the administration could do to make it more difficult for people to access insurance through the marketplace. One of those things could make it, that they could do would make it less attractive for insurance companies to participate. For instance, make the regulatory process more burdensome. That would be destructive. Obviously, anytime we hamper the ability of Missourians to access private insurance, we're leaving people uninsured.
When they're uninsured, when they become uninsured and they go to the hospital, we heard yesterday from Ryan Barker that uncompensated care is drying up because the idea was that these people would then become either insured or go through the expanded Medicaid. So because uncompensated care is lessening, rural hospitals are closing. Those people who are going to the emergency room, are we paying for them?
That's right, yes. So hospitals, in order to stay open, are passing along that cost to the rest of us if they're not being compensated by, the uncompensated care dollars. So what we've seen is that gets wrapped into the cost of premiums that the rest of us pay because the prices that hospitals would charge your insurance companies would increase to make up for that. We also know that, people who go to the emergency room because they weren't able to get preventative care are going to have much more catastrophic and much more expensive illnesses by the time that they get there. There are folks, one of the things that we know, just as an example, is if we cut Medicaid, people with mental illness who could be well functioning in the community just with regular prescription medication and counseling, those folks end up in much more dire circumstances and going to the hospital with severe illnesses.
It was announced that Centene took over for those counties in the western part of the state that are going to be without an exchange program, right? That's going to happen, isn't it?
Yes, that's moving forward, and so those counties will have coverage. So as you know, I think that one of the things that we've seen in the debate on health care this year is that insurance companies are nervous. You know, they don't know what to expect from Congress, not unlike the rest of us, but they're nervous about that, and so you've seen fluctuations in the market of insurance companies leaving and insurance companies coming in. But what we know is that they really prefer a more stable environment.
Amy, what is the Missouri Budget Project? Explain, people.
Sure. We are a nonprofit, independent organization. We analyze policies that impact Missourians and our quality of life, our economy, and help to inform those policies as they're crafted.
Amy Bluen, Executive Director of the Missouri Budget Project. Do you have a website?
We do, www.mobudget.org.
There you go. Amy, have a good day. Thanks for checking in.
You too. Thanks so much.
7:57.